So what I'm going to talk to you guys about today is Biots respiration. It's actually not pronounced Biots, so that was something fun that I learned. So the cause and mechanism for this type of breathing pattern is that it usually comes from a neurological disease which affects breathing cycles and rhythms. Several classic central periodic breathing patterns have been described. Biots breathing, also known as ataxic breathing, is a breathing pattern in patients with acute neurological disease, but it is rarely mentioned in the neurological literature. It can be contrasted with Cheyenne-Stokes breathing, which is the periodic stereotypical crescendo-decrescendo. And then there's the apneustic breathing, which is the periodic prolonged inspiratory hold. Biots breathing may be a rare phenomenon or just not noticed. So, who was Biot? Biot wrote two main articles on breathing patterns. One large exploratory work focused on his observations on Cheyenne-Stokes breathing. In his first article, curiously in a postscript, he described a patient who had respiratory movements that gradually decreased and increased but were irregular. And he was one of the first to publish recordings of this type of respiration in a 16-year-old patient with tuberculosis meningitis. He distinguished this breathing pattern from Cheyenne-Stokes breathing. The breathing pattern is irregular and rapid, with rhythmical pauses lasting 10 to 30 seconds, but sometimes with alternating periods of apnea and tachypnea. This breathing pattern lacked the crescendo-decrescendo cycles attributed to Cheyenne-Stokes breathing and was completely irregular, with varying periods of apnea. So, Biots breathing is often confused with cluster breathing, regular cycles of deep breaths with variable periodicity. Many publications have inappropriately described Biots breathing as a periodic and consisting of groups of full respiratory effort. Biot concluded that a big sigh comes before the pause, and that periods are irregular. These are the two main characteristics that will always be seen in meningitis and thus should be considered a characteristic but different from the regular crescendo and decrescendo cycles of Cheyenne-Stokes breathing. So Biot's official definition is an abnormal pattern of breathing characterized by groups of quick, shallow inspirations followed by regular or irregular periods of apnea. Biot's respiration is caused by damage to the pons due to strokes or trauma or by pressure on the pons due to herniation. The pons contain nuclei that relay signals from the forebrain to the cerebellum, along with nuclei that deal primarily with sleep, respiration, swallowing, bladder control, hearing, equilibrium, taste, eye movements, facial expressions, facial sensation, and posture. So I included this YouTube link for you guys to listen to if you would like to listen to some of these forms of breathing patterns. And I would recommend listening to them with your headsets on because it is kind of hard to distinguish between Cheyenne-Stokes. Thank you.